COVID-19, it is now crystal clear that this virus is extraordinarily contagious and is now beginning to overwhelm our healthcare system here and across the nation. Though multiple pharmaceutical companies have requested emergency approval from the FDA for their coronavirus vaccines, there is still little clarity as to when the door to this pandemic will finally be closed. This uncertainty is leaving many Monroe County residents with questions on what their future holds. Tonight, we're joined by three people who can help answer your pressing questions. Monroe County Executive Bello and Monroe County Public Health Commissioner Dr. Michael Mendoza are here in studio, socially distanced, of course. And over Zoom, we're joined by Congressman Joe Morelle. Gentlemen, thank you so much for being here once again. This town hall will last 1 hour, and we want to get to as many questions as possible. We're going to direct the first one to Dr. Mendoza. And Dr. Mendoza, this one comes from Roseanne Nelson in Brighton, and she asks, please explain how and what tracing is being done as follow-up to increased positive test results. Who does the tracing and who pays for it?
Well, thank you for your question, Roseanne. Contact tracing is a tried and true method in public health. We've been using contact tracing well before the COVID-19 pandemic for other sexually transmitted illnesses and other situations, but obviously with the COVID pandemic, contact tracing has taken on much more greater significance. The purpose of tracing is purely this: to identify people who might be at risk, to inform them so that they can take proper precautions, and that is completely all we are trying to do. The members of my department in the Department of Public Health are who conduct this tracing, and that's who pays for this tracing. And the challenge, of course, now is that as numbers increase, the job of doing the tracing gets harder and harder. Because there's more volume, we have many more patients to contact, and also because it's much more difficult for people to identify where they might have contracted this infection. And that's largely because people are not as careful as we think they should be with regard to their social distancing and their gatherings. So at the end of the day, contact tracing is a tried and true method in public health. It is in many ways the last line of defense for us in a pandemic situation, and we want everybody to take the process as seriously as they possibly can.
All right, Dr. Mendoza, thank you. We're going to direct the next question to Congressman Morelle, who again joins us via Zoom, and this question has something to do with today's headline. A bipartisan group in Congress presented a $900 billion stimulus proposal. You might have seen it. It includes $300 worth of enhanced unemployment benefits, some aid to states and localities, liability protections for businesses, but no direct stimulus checks to folks out there. Is this something, Congressman Morelle, that you can get behind? And if not, what does a bill look like that you could support?
Well, thanks, first of all, for inviting me to be here. I'm sorry I'm remote, but I'm here in Washington, and hopefully over the next week to 10 days, we'll be able to make some headway on the issue that you just raised. You know, first thing to note, Adam, is the proposal, and there are many floating around. So, you know, my hope is that we'll be able to agree on something that's bipartisan, bicameral, and can get the support of the White House. But it is important to remember there are millions of Americans who are struggling right now. We hear from people every single day in our office, people who have been unemployed, people through no fault of their own, people who are sick, people like hospital workers who are working overtime now. So we're in the midst of a crisis, and we act. So back in May, the House passed the HEROES Act, which was about a $3.4 trillion package that did a whole host of things. Back in October, I think on October 1st, we did an updated HEROES Act to try to scale back in response to some concerns people had that the original package was too broad. And here we find ourselves now in December, trying still to get the Senate to come along and the White House to come along. I pray that there will be something we can do. I would certainly, you know, welcome the opportunity to talk to people, but it's got to have some basic things. I mean, we have to make sure that we're addressing unemployment insurance and the people who are unemployed. We have to make sure that there is direct payments for families. I mean, families are struggling. We have to make sure that there's a piece in there for small businesses. So many small businesses are struggling right now. The vaccine and the potential for vaccinating so many people is really the light at the end of the tunnel, but there's a long way to go to get there. And obviously, school districts, hospitals receive significant support from the state government. So state and local government support has to be in there. I think that the package that I've seen so far is, in my view, too little. I would like to see it be more robust, but I think right now we're looking to get something done, get us to January when the Biden administration, who will take this, I think, much more seriously than the Trump administration has, will be set to address the 117th Congress in January.
Congressman Morelle, thank you. We're going to take a short break. When we come back, we're going to be talking with County Executive Bello specifically about schools, testing, and in-person learning. Stay with us. All right. We are going to restart our coronavirus Facts First town hall right now with a question to Monroe County Executive Adam Bello. We promised to talk about schools. This question coming from Jessica O'Connor, and she points to New York City as the mayor there is hoping to reopen elementary schools for in-person learning, possibly by December 7th. And she says, many are wondering why local districts are still getting messaging from the county that 5 days in-person learning is not possible. Where is the phased plan to return all districts to 5-day-a-week learning?
So that's a good question. And how the school districts open and go through their opening process is a school district-driven decision that's based on many different factors. First of all, there's a testing requirement depending on what zone you're in. If you're in the yellow zone, the orange zone, and the red zone, which have been updated and changed this week. But I'm a firm believer that with our schools need to be open, and we need to work with our school districts to have as much learning as possible, either in-person learning as possible and remote. But there's a lot of different factors, though, that go into that the schools are working through. The first factor really is about space, making sure that the kids, while they're in school, can maintain that 6-foot distance within the capacity of the school building. Another factor is based on how much faculty staff is available, and then how to balance that with families that choose to do the remote learning option. So there's a lot of different factors, and each district is going to look a little bit different. Right now, the Rochester City School District is all in remote right now, but there's other districts that are 2 days a week, some are 3 days a week, and there are districts that are 5 days a week and do have the 5-day-a-week in-person learning option. And so it all depends on the school district and really what their space and availability is, and that's really going to be driven too, and that's why it's been so safe, I think, inside the schools, because I get this question a lot of why does it seem like the positivity rate is so high amongst the community, but it stays low within the schools when we're testing the schools. And it's because the schools are following the guidelines. The kids are wearing masks. The teachers and the principals are wearing masks. The desks are set up 6 feet apart. At lunchtime even, they're wearing their mask when they talk to their classmates, but they take their mask off to eat. They're following all the different rules that have been set out in the guidelines, and they're keeping the spread low. But not every district is the same, and not every school building is the same in order to keep the capacity and be able to follow those guidelines. So I'd encourage you to work with your school district as you go through this testing period that's coming up. Make sure we stay on top of the testing and work with your schools as we go forward.
Thank you, County Executive Bello. Dr. Mendoza, you heard Adam Bello mention masks, so it helps me get to Jessica Bagley's question. How effective are masks, she asks. In a gathering of 5 people, if one has COVID, how likely is it that the others will be protected? I'm wondering if it's better to just avoid seeing family or if masking is really a sufficient means of protection in small gatherings. We also have children under 2 who will not mask, so that is a consideration, according to Jessica.
Well, Jessica, this is perhaps one of the most difficult questions to answer. On one hand, we can say very clearly that masks work. Now, how effective are they? Are they all created the same? Are they perfect? No, they're not perfect. No, they're not all created the same. And no, they don't all work in the same fashion. But we do know from local data, from published data, that if enough people wear their mask, it has been proven to decrease the spread of COVID-19. We know that, first of all, because in schools we've had a number of kids who have tested positive, and we have not identified any known cases of in-school transmission when masks are present. When we look to private gatherings, which we still believe are the vast majority of cases that we are seeing here in Monroe County, the vast majority of those have arisen in situations where people were not properly distanced and or were not wearing their masks. Now, the situation you present is difficult because at the end of the day, it's a personal choice. How do you weigh the risks and benefits of wearing a mask in the presence of your loved ones versus not visiting them at all? Obviously, not visiting them at all is the lower risk situation. But we have to look at this as the complex situation that it is. We can't live life in fear, and we can't live life assuming that we will never encounter our loved ones in our family. But we do need to be thoughtful, and we do need to be thinking ahead about the risks that might pertain to a particular interaction. We know that indoor interactions are much more risky than outdoor interactions. So if you're going to be indoors, we suggest that you wear your mask and keep 6 feet distance whenever possible. If you need to take your mask off for eating, for example, at a meal, do your best to try to keep some of those 6-foot guidelines in place, and we understand that's difficult. So because it is so difficult, the other piece of this equation is to think about who you're gathering with. The more people in a gathering, the higher the chance that there will be somebody in that gathering who has an asymptomatic case of COVID. So in that case, the way to decrease your chances of contracting the infection are to keep your gathering size small. But when you look at all of this in balance, there is no guaranteed way that anybody can tell you that anything is 100% safe, short of staying in your home and completely away from other people. So what I want people to understand is that masks work. And if enough people use their masks, and we know this through local experience, we can go a long way toward decreasing the transmission of COVID-19 in our community.
Dr. Mendoza, thank you. We're going to be right back with more of our coronavirus town hall. We're going to be talking about quarantining, more on schools and the orange zone. Stay with us.
a substation that has no backup source, so
Welcome back to our Coronavirus Facts First Town Hall. This question is going to go to Congressman Joe Morelle. Congressman Morelle, we had Martha write in saying the pandemic has taken a toll on our economy, causing millions of families to lose their jobs. How can we get back on track once COVID is under control and create new jobs?
Well, it's a great question, Martha, one that we spend a lot of time thinking about. There's no question that in order for us to get to the other side of this a pandemic issue, we're going to need some bold investments and bold ideas. I think there's three things we should do. In the first instance, we have to pass a stimulus plan that I talked about, mentioned earlier. It has to have support for small businesses and for those businesses who may be larger but struggling because they face particular hardships. So that's something that has to happen. In entrepreneurial circles, they sometimes refer to a valley of death, where a new company has a product, needs to get it to market, and the question is, can they survive the months needed to get it to market? Well, this is sort of similar. We face a new type of valley of death, which is businesses can see the opportunity when people are vaccinated, where people can go back out but can't get there. So we need to have a stimulus package to support it. Second thing we need to do, and I think the president-elect is very much into this, is a significant infrastructure package. That will put people back to work. It'll be public works, that it's transportation, but also care facilities, educational facilities, research facilities, broadband deployment. So that's part two. The third part of the strategy is something that I've been working on here in Washington in a bipartisan way, and that's an innovation strategy. So I want to create an $80 billion 10-year fund that will reward communities, up to 9 or 10 communities across the country, that are really doing a great deal to build entrepreneurship through innovation. Rochester is one of the leading communities in the country. If you ask people in these entrepreneurial circles, they'll say we have all the ingredients need an investment of capital, and the federal government can do it. So I think it's stimulus package now to get us through, an infrastructure package which will invest in America and retrain workers, and then finally an innovation strategy that will reward communities that really can take off based on new innovation in the marketplace. So that's the things that I'm working on that I think will really aid the stimulative effect that we need for our economy.
All right, Congressman Morelle, thank you. County Executive Bello, this next question comes from Kate Young. I am wondering how effective we are actually being at containing the spread. With designated orange zones, people are still allowed to travel to other zones for work and can even patronize businesses outside of the orange zones. How can this help stop the spread if people from the larger positivity rate areas are still able to frequent businesses, bars, restaurants that are in the yellow or green zones? Shouldn't it be an all or nothing?
Yeah, that's a really good question. What you said is true. And a lot of what, a lot of the restrictions when you go through shutdowns, a lot of this is about balance, and it's also about trusting that people are going to do the right thing and asking people to think about not just themselves, but their neighbors and their community and how we reduce the spread. There's two options about the way to go about this. One is you could shut everything down. The other option is to look at where are areas around the county, around the state, they're doing this statewide. Where are there areas where there's clearly something different happening? Where is there clearly a concentration of cases, positivity rates? You're looking at hospitalization numbers, you're looking at community spread. Where is something happening where something is different? And then how do you target in there to try to avoid the whole shutdown, which would have a much more negative effect on the economy, have a negative effect on our schools, being able to keep them open, and there's a lot of dominoes associated with that. So how do you really target down? There's communities that have done this across the state. I'm looking at Broome County, had an orange zone designation, and they were able to get back down into yellow because they had a lot of community participation. And so we really are asking people to do the right thing. Think about where you live, think about where you are on that chart and in that zone, and then think about how your behavior impacts and what you do impacts those around you and impacts that prevalence of the virus and the spread. So targeting clusters is the strategy. Now, earlier this week, just yesterday, the governor announced a new approach to how we designate what those zones are and how we designate the clusters. Instead of just looking at positivity rates, they're also now going to start taking a look at hospitalization rate, death rate. They'll still look at the case rates. They're also going to start looking at hospital beds, available ICU beds, hospital staff, load management, all sorts of other factors that are going to go into how we designate a yellow, an orange, and a red. So I would expect additional changes to be made coming forward. But I agree with you. It can be frustrating because anybody can just go anywhere outside because we're all just mobile. But what I'm asking the community to do is to think about how your behavior and what you do, where you go, if you're wearing a mask or not, how many people are going to the grocery store, where you're going. Think about how your actions impact everybody else around you. That's part of what being a good citizen is about. And if we all work together at this, we'll get back to where we were earlier this year. We flattened the curve once before. We could do it again. But we want to try as hard as we can to avoid having to take that next step. We do not, as soon as you start to do the massive government shutdowns where we were earlier this year, you have a lot of small businesses that are struggling, you have a lot of families that are struggling, and it's going to increase that pain. So we have a responsibility to those, particularly those who are in the orange zones right now, to do the right thing. We need to double down on our efforts so that they can get back open and that we can put their families back to work as well.
County Executive Bello, thank you. The next question in the queue is for Dr. Mendoza, and we're going to get to that one in just a moment. Stay with us. Welcome back, everybody. I'm going to go off script here for just a minute. Dr. Mendoza, you mentioned a few minutes ago that the primary source of spread in our area was private gatherings. Does this mean that people aren't getting COVID at bars, restaurants? And the other aspect of this is Governor Cuomo recently took issue with the assertion that we're not seeing a prevalence of COVID-19 in gyms, salons, and barbershops. Your take on that large question?
Well, I think the goal that everybody wants to get to the bottom of is, where is this coming from? And we're at the point in the pandemic where it could be coming from any of these places. Now, to what extent does that shape our behavior? I think that's the million-dollar question going forward. When we look at the data locally, by far, the vast majority of cases are coming from private gatherings, typically in people's homes or in their backyards, and almost universally involving parties who are not wearing their masks or who are not observing social distancing. Now, that doesn't mean it doesn't occur in other places. We've reported examples in restaurants and in bars. To be frank, we haven't seen any examples of cases in barbershops or hair salons, but that doesn't mean it hasn't happened there. I think the reality is that the illness is so prevalent now that the better part of caution would be to assume that anybody around you might be one of those asymptomatic carriers, and to conduct ourselves accordingly, meaning wearing our masks, keeping our distance, and again, trying to be thoughtful about how and when we interact with other people. But of course, we want to try to find, and the purpose of contact tracing is to find where those sources might be. We want to find the obvious clusters and outbreaks and put a lid on that, so to speak. But I think at this point in the pandemic, the right answer is to assume that anybody might have it and to use universal precautions and do everything you can to keep yourself and your loved ones safe.
Dr. Mendoza, thank you. That concludes the first half hour of this town hall. We're going to pick right back up in just a moment. We're going to talk about schools, once again, specifically testing, sports, and the hospitals. Stay with us. You are watching the News 8 Coronavirus Facts First Town Hall. This question for Congressman Joe Morelle. Congressman Morelle, Barbara Gadd called me with this question. She said, look, in a week or two, I might be out of work, and yet I look on TV and I see pro sports continuing. So her question is, why are national sports franchises allowed to continue to play while we're seeing orange zones, red zones here in New York?
Well, that's a great question. You know, obviously each league has not only its own protocols, but they are governed by whatever local community or state regulations exist. So, for instance, the Buffalo Bills play, and the NFL has its protocols, which the teams are all following, but they're also subject to New York State rules. So the governor's allowed them to play. They're the only team that plays in New York. The New York Jets and Giants, of course, play in the Meadowlands in New Jersey. What the governor's also said, however, is that you can't have fans in the sense in Buffalo. You'll note some NFL games are played with a minimal amount of people, but that again is state to state regulation. So there's no federal regulation related to it, and the leagues are working in cooperation with local facilities. I note that the San Francisco 49ers had their facilities entirely shut down. They reached an agreement, I think, yesterday with the folks in the state of Arizona, and I believe they're going to play some home games in Arizona at the Arizona Cardinals facility. So I think there is some question whether the NFL will complete its season. The Pittsburgh Steelers, a game which was scheduled for over the weekend, was pushed to Tuesday. Now it's been pushed to Wednesday. There's real concerns, but the federal government doesn't regulate that. That's really up to the states and the local communities. And I would say this, Barbara, and we're terribly concerned about the people who are losing their jobs. That's why I talked about the stimulus package, why it's so important to be able to get a relief to small and businesses that have been impacted and large businesses that have been impacted. So those layoffs don't occur. And if they do that, we have unemployment benefits as we did at the beginning of this crisis. So we're clearly paying attention to that mostly. And as I said, the sports franchises and the sports leagues are really under the jurisdiction of the various states and do have protocols in place.
All right, Congressman Morelle, thank you. County Executive Bello, this question is for you. How can the tests given to the schools be valid if only a handful of people test positive out of thousands that have been tested when our community is on fire with this virus?
Right. Well, this goes back to what we saw when we went into the schools a couple weeks ago and they went into the yellow zone. So the schools were tasked with testing 20% of their students that were and teachers and faculty who were there for in-person instruction over a 2-week period to look at what is the infection rate within inside the schools and then compare that to the infection rate outside of the schools. And what they found was that the infection rate inside the schools is a lot lower than it is out in the rest of the community. That is not something that surprises me. And like I said earlier, it doesn't surprise me because the schools are following the regulations. You have a very tight, closed environment inside the schools where they're wearing their masks, they're keeping a social distance, and they're washing their hands like crazy. And when you have that environment and you're following the guidelines that are set forth, you're going to have a lower spread. We also, I think, can back up what those numbers are showing us through our contact tracing. We have not really found to date through the contact tracing any real evidence of spread within inside the school buildings. We see it amongst private gatherings in people's homes. We see it in other places of the community, but not inside being traced back inside the schools. So I think the data from the tests is backing up what we knew anecdotally by looking, by talking to our families, seeing what we see in schools, but then also what we saw through the contact tracing.
All right, County Executive Bello, thank you. When we come back, I'm going to direct a question to Dr. Mendoza about hospitals. I have a friend who works in the emergency department. He says that COVID-19 is, in his words, is now in all the cracks of society. So what does it look like in the hospitals? That question will be answered coming up. Welcome back to our Coronavirus Facts First Town Hall. This question is going to Public Health Commissioner Dr. Michael Mendoza. Dr. Mendoza, first I want you to kind of give us a picture of where we are with hospitals right now. And then when you're done with that, Betsy Rice has this question. If the virus is more prevalent among younger adults and our treatments have improved, why are the numbers of hospitalizations going up so rapidly?
Well, the hospitals represent probably the most precious asset beyond our community itself. When we get through this pandemic, we're going to look back on these days and say, you know, the hospitals really came through for us. But right now we need to come through for our hospitals. Our hospitals are under a lot of stress. In fact, as I'm standing here, I just got an email from our department chair indicating that Strong Memorial Hospital is experiencing a very concerning surge in hospitalizations and admissions. This is very real. And when we talk about flattening the curve, there are many curves that we might be referring to, but the curve that particularly matters is the capacity in our hospitals. And when we look at our hospitals, I want our public to think of a number of things. Number one is that our hospitals represent a regional asset. And so when we look at Monroe County residents only, that's only part of the picture, because our hospitals serve the entirety of our Finger Lakes region and beyond. And so when we look at the number of hospitalizations in our hospitals, we've got to be looking at the entire region, because as Ontario and Yates and Steuben County go, so goes Monroe County. That being said, we have come a long way in terms of treating this illness. If you look at the proportion of current hospitalizations where people are in the ICU and or on a ventilator, that proportion is smaller than it was back in March and in April. Now, there may be a number of reasons for that. Number one, maybe we are getting better at taking care of this illness, and I believe that is true. But there may also be some intrinsic factors to this illness that may be explaining why fewer and fewer people need to go to that level of acute ICU level care. But the reality is the numbers that we're seeing now are dwarfing what we saw in March and in April. The number of cases is higher than it ever has been before. The number of hospitalizations has been higher than it has ever been before. And our hospitals are reaching their capacity. So what we can do is do everything we can to prevent the spread of COVID in our community. And most importantly at this point is to get our flu shot, because that flu shot will help to decrease hospitalizations. We are still relatively early in this influenza season, and we ought to be doing everything we can to come through for our hospitals, because at the end of the day, when we or our loved ones are sick, we're going to be looking to the people in our hospitals to come through for us.
Dr. Mendoza, thank you. And I'm going to piggyback off of Dr. Mendoza's answer here to bring in the next viewer question, and this one's going to go to Congressman Morelle. This viewer asks, I am not disputing the rise in cases as a serious issue in our community, but a few thousand known active cases have or may have COVID-19. That is still less than 1% of Monroe County's population. Even though I have hunkered down, it seems like the chance of catching COVID is low. No? Congressman Morelle, what would you like to say to the viewers out there who might wonder how contagious this virus actually is?
Well, look, I would frankly rely on Dr. Mendoza and other folks like the CDC. But, you know, we're closing in on 270,000 deaths in the United States. Some people will say to me, well, isn't this basically just like the flu? Well, first of all, the flu we have a vaccination for, so it's not like the flu. We lose 30,000 people annually to the flu, roughly speaking. This is 10 times that amount by the time we get to, or we'll pass 10 times that amount by the time we get to next January and February when we first started to detect the virus in the United States. So this is deadly. And, you know, consider how many people have died and how many people are hospitalized now, and all the people that are taking appropriate precautions. I mean, that I think gives you a sense of the danger of the virus. And look, we're going to mobilize the entire federal government come January. I do think that President Trump has been preoccupied with election issues and really hasn't paid much attention, hasn't met with his coronavirus task force, which I think is borders on criminal, that we have what he basically equated to a war. That'd be like FDR ignoring the World War II while it was going on and talking about his election prospects. But having said that, this is very dangerous. I would certainly leave it to Dr. Mendoza to talk about, you know, as a medical doctor. But clearly the numbers tell us, despite all of our precautions, 275,000 Americans have died in less than a year. That's to me you don't really need to know anything more than that to know how serious this is.
All right, Congressman Morelle, thank you so much. The next question that I'm going to ask right after this break is going to be for County Executive Bello, and it has to do with folks who don't mask when they're out shopping at the grocery store or a retail store. He's going to talk about that in just a minute. Now back to our coronavirus facts first town hall. This question from Monroe County Executive Bello. This one comes from one of our viewers. We're going to call her G. She says she shops at Wegmans and Walmart. When she goes in, she sees some people without masks or the masks underneath their nose. And her question is, how can people stay safe and still get to go shopping for food when people aren't following the rules?
Right. So there's a couple of things I'd say to that. First is that I want to talk to the people who are not wearing their masks when they go out shopping and they're around other people. When we're facing a global pandemic, people are losing their jobs, businesses are going out of business, people are getting sick, and people are dying. And in the midst of a pandemic, you have two choices. You can either be part of the solution or not. The solution here, and part of the way we get out of this, is by wearing our masks. It's by understanding that your actions affect other people around you, and you, by not wearing a mask, are part of the spread of the disease. So we need to have everybody come together and follow the rules and the regulations. The other thing is that when it comes to people violating the rules, we will enforce the regulations here in Monroe County. We have a hotline, 753-5555. When you're out and you see that one of the regulations being violated, you can call the hotline and the appropriate agency will respond. But when you're also in that grocery store, we should also remember, or any other retail establishment, you should also remember that the prevalence in our community is high right now. The positivity rate is high. You should conduct yourself when you're out as if people around you are infected, and you should conduct yourself as if you're infected as well. And so what steps can you take to make sure you stay safe? Those steps include making sure you give people distance. Don't get within 6 feet of other people. Stay away from people as far as possible. Make sure as you're going in and out of the stores, you're washing your hands. Make sure you are wearing that mask and you're using it correctly. So you take steps to protect yourself. I'm asking people who are not wearing their masks to please start wearing your mask. The numbers are going high and we have it in our power to bring it down, but we all have to work together and realize what we have, the power that we have to help slow the virus in our community. It's at our fingertips and we have the tools, we just need to use them.
All right, County Executive Bello, thank you. Dr. Mendoza, I'm going to ask two things of you. One, where can people go if they want to find out about guidelines or recommendations when it comes to quarantining? And there's one specific quarantining question coming from Julie M. this evening. What is the recommendation for quarantine when someone in your household has been in contact with a positive case?
So quarantining is a new concept for virtually all of us. It's not something that we've ever really had to do in this magnitude in recent memory. So first, let's review. Isolation is for individuals who are confirmed positive with this infection. The most important thing we can do as a community is to stay home if we're sick, and especially to stay home if we're confirmed positive with COVID-19. Now, quarantine applies to those close contacts who were in contact with that person who has the infection. And the goal of quarantine is to try to observe them to make sure that if they do develop the infection, we've done everything we can to minimize further spread beyond that ring of first level contacts, if you will. And so we would quarantine the close contacts, meaning people who were within 6 feet of the confirmed person for more than 15 minutes, particularly if either party was not wearing their mask. Now, it becomes a balancing game because you could go the next step and want to quarantine that second level of contacts, but then it becomes a risk and benefit situation. And our belief and the CDC's belief, and all of this guidance comes from the CDC, our belief is that quarantining that second level of contacts is probably not yet worth it because we want to observe whether that first level of contacts develops the infection. So at the end of the day, we isolate those who are ill, we quarantine those who are at highest risk, but we encourage everybody to take appropriate precautions.
And the guidelines are right on the county's website for people to get, Dr. Mendoza?
Yes, they are available on our COVID-19 website at monroecounty.gov. They're also available at the New York State Department of Health as well as the Center for Disease Control and Prevention.
Wonderful, thank you. We literally have just 1 minute left. So Congressman Morelle, what is the final message here that you have for folks who have been watching this town hall?
Well, I'd say a couple things. And first of all, thank you for doing this. I think you do a huge public service, and thanks to Adam Bello and Mike Mendoza. I don't think two on their jobs have done a better job in the country anywhere. But I think the takeaway is listen to health professionals, listen to scientists. We're struggling, but we're going to get the vaccinations out over the next several months. You probably have 4, 5, 6 months before it gets to the general public. But people have got to listen to what Mike Mendoza and Adam Bello say. Mask up, social distance, practice personal hygiene. We will get through this. You know, we're getting closer and closer to the end. but just persevere. I know this is tough, but we're going to get there.
Congressman, thank you. And I want to thank Monroe County Executive Adam Bello, County Health Commissioner Dr. Michael Mendoza, and Congressman Joe Morelle for participating in this very important conversation, especially right now. And I want to thank you, the viewers, for watching and submitting some wonderful questions. To rewatch tonight's town hall, just log on to our website, rochesterfirst.com. News 8 at 6 is coming up next. Stay with us.